These are very distressing times. My name is Dr. Stacie Walton. I am a pediatrician. I have a background in public health. My pronouns are she, hers, and hers. I'm a cisgendered, straight, able-bodied woman. That's my identity. As an African-American woman, I do experience oppression, and I understand how that relates to the numbers that we are seeing in the news right now. When COVID-19 came on the scene, it was clear to me, I knew we were going to have a disproportionate number of deaths in the African American community. And the reason I knew that, but I didn't expect the numbers that we are seeing. And history or time will help us explain why the numbers are so high. But in recognizing that the African American community was already experiencing epidemics of poor health and epidemics of excessive death, it wasn't surprising to me that we would have high numbers. The question is why? Why is this happening? I think we cannot underestimate the level of mistrust that exists in the African American community towards the health system in general. And this mistrust is very rational. When you look at the historical trauma that African Americans have experienced with the health system, when we go back to the days of enslavement, when healthcare was not accessible to us, when we look at Tuskegee, when we look at Henrietta Lacks, when we look at the mustard gas studies in the 40s, when we look at I could continue to list those historical traumas, but it's not surprising that when the COVID-19 came on the scene, when you looked at social media and chat, you saw how rumors were going around that this virus would not affect us. We know COVID-19 affects human beings. It is not about the color of your skin, your ethnicity, etc. But because of the inherent social determinants of health, and what I'm going to say here is there are conditions under which African Americans are living daily that increases chronic stress. Chronic stress decreases your immune response. We're dealing with a virus, and so some of our protection against that virus involves having a strong immune system. That's one thing. The other is the lack of access to care. Yes, in the African American community, we have comorbidities of diabetes, hypertension, respiratory illness. But the bottom line is we also, because of lack of access, healthcare is a privilege in the United States. It's not a right. We don't all have access. That those diseases are also going untreated. So you have African Americans coming to this epidemic, this pandemic, with untreated comorbidities. And we cannot ignore, and this is not just exclusive to African American populations, but that's what I was asked to speak on. But if you are poor in this country and do not have the financial ability to pay for medications, you will have chronic diseases that kill you because they go untreated. So mistrust. So when the public health recommendations came out, many of us ignored them. Rumors of this will not affect African American people. People continue to congregate at their churches. Why? That's a source of comfort. It's a source of connection, not realizing the harm. On top of that, there are some governmental agencies and some political people with power in our government who chose not to take this seriously. There were events that happened in New Orleans and Chicago that should never have happened, that large groups of people congregated.
Thank you so much, Dr. Walton. And now we'll go to the last speaker, and then we'll go to answer questions. We have a lot of questions coming up. Next up is Dr. Danielle Turner-Lloveras, Assistant Professor of Medicine at Harbor-UCLA David Geffen School of Medicine at the University of California, Los Angeles. Please go ahead, Dr. Turner-Lloveras.
Hi, everyone. Thank you for that kind introduction. These are troubling times, as our speakers just said. Stacie Walton. And these are difficult times for vulnerable populations. The problem is that we already had a population that were vulnerable prior to arrival of the pandemic. Now, with the situation as it is, those difficulties are just doubled and tripled. Something must be done to help out these groups in the African American community, in the Latino community, and really anyone in a socioeconomic situation that places barriers to access to care, and also access to a healthy community. We need to ensure publicly funded health insurance. We need to make sure that everyone, whether documented or undocumented, has access to care. And that is not just before the pandemic, but if you look at it in the pandemic that we're currently in, you really cannot contain a virus that's spreading across the world if you're saying that only some of these people can have easy access to the care that they need. What we're doing is public charge is a public health threat, and it just needs to stop right now. Provide emergency funding for neighborhood clinics. We just released part of the COVID funding, and we need to make sure that these get to neighborhood clinics, because these are the safe zones where our immigrant population feels safe, accessing care. And there was recently some information that was leaked from the Border Patrol that 2 weeks ago, Trump has started a program called Operation Capio, that it relies on this obscure power that was given to the CDC that allows Border Patrol to ban the entry of people or things that might spread infectious disease in the U.S. And for the first time ever in the history of the United States, they've been given legal authority to expel migrants without any type of process. So far, ProPublica has reported 7,000 people have been expelled